Okay, so today we have Lara Taylor. She is a 35-year-old female G3, A2, who presents to the clinic today at 20 weeks gestation. Chief complaint was she was here for her second prenatal checkup and she wanted to see somebody closer to home. Her other complaint, she reports some constipation and lower back pain for the past 2 weeks. It's worse when she lays down and does get a little better when she's up and moving. Has not taken anything over the counter, has not got any relief. She did report a bowel movement this morning. She's allergic to latex. We'll give her a rash. Medication wise, she's currently taking prenatals. She was on Prozac but stopped 2 years ago due to the way it made her feel and constipation. Past medical history, social and surgical history. She does have a history of depression. She had an induction abortion at age 18 and a D&C at age 31. Now, Lara is a 3rd grade teacher, has a bachelor's degree. She is married, lives with her spouse. She does state concerns of financial issues because her husband doesn't have a job. She does feel safe at home. She did used to smoke cigarettes, marijuana, and drink alcohol, but stopped when she found out she was pregnant. Upon review of her systems, she does report she's gained about 8 pounds. Does report that lower back pain and constipation for the past 2 weeks. Reports increased frequency when she's urinating and a history of depression. Lara is sexually active, has only ever used condoms, has never had a STI or STD, has no menstrual complaints or issues. Last PAP was 2 years ago and it was normal, so recommendations is every 3. Objectively, vital signs look great. 132/64, pulse 75, respirations 20, temp 36.2, 130 pounds and 5'5". Upon just physical assessment, she is alert, oriented. She is well appearing, well nourished. CV, she has a regular rate and rhythm. There's no clicks, no rubs, no murmurs. Respiratory, her lung sounds are regular. They're clear to auscultation bilaterally. Abdomen is soft, non-distended, non-tender to palpation. Denies complaints with breasts. Genital urinary is completely normal. Psychiatric, she is alert, oriented, very, very pleasant. So diagnosis, we look at a routine prenatal visit at 20 weeks with some constipation and back pain, uterine fibroids, and then irritable bowel disease. So final diagnosis, I chose a routine prenatal visit at 20 weeks with some constipation and back pain. We know during pregnancy, we have a lot of hormones running, and this can help cause constipation. She's here for a routine prenatal visit, and those are important to make sure mom and baby stay healthy. So medications, we're going to give her some stool softeners. We're going to educate her about increasing her fiber, increasing her fluid, and some exercise, like 20 to 30 minutes 3 times a week. We did do a urine dip and an OB ultrasound. Those are both normal. We will educate her just about how constipation is normal in pregnancy. And then we also need to consider that there is spousal strain here in their relationship with her husband not having a job. So just want to have some open communication and let her voice any needs or concerns. If constipation continues, we can refer to GI, do some counseling for concerns with her spouse. And then follow-up wise, we will follow up in 4 weeks with routine prenatal care. And then after the next visit, we'll increase frequency as we're supposed to. Looking at our other diagnosis, she did have the ultrasound. It didn't show any fibroids, so we ruled that out. And then IBS is something. Some other health promotion is just educating her about treatment, educating mental health awareness and resources, and then offering her some vaccinations that are available during pregnancy.